Hello, my name is Helen Cox and I'm a head and neck cancer surgeon. Cancer of the head and neck can be found in a number of different areas in the head and neck. It can affect the voice box, the swallowing tube, the tongue, the mouth, the nose, the salivary glands and the thyroid. Patients often present with a lump in the neck, a hoarse voice or a sore throat, and sometimes with difficulty swallowing. Your GP is likely to refer you to us on a suspected cancer pathway or a 2-week wait. You will be seen, assessed and managed urgently. If you have a lump in your neck, you may well require an ultrasound scan and a biopsy. This is where a needle is inserted into the lump in the neck and some cells are removed to help with diagnosis. This may be carried out on the day you are first seen or shortly afterwards. Neck lumps can indicate that there is something going on elsewhere in your throat or voice box. Part of your examination when you first attend may well include an examination with a small flexible telescope which goes through the nose to allow examination of the nose, throat and voice box. Other scans such as CT scan and MRI may be required. It is quite common to require a biopsy of a suspected cancer in the head and neck under general anaesthetic. This is where you go to sleep. The team will assess the problem, take a biopsy. You are likely to be home on the same day. Once we have the information required to make a diagnosis and to know how the cancer is affecting you, we will see you in our clinic to discuss the treatment with you. At this appointment, you will be introduced to a cancer head and neck nurse specialist. They will be there to support you and your family during your cancer journey. Your surgeon will discuss the recommended treatment for you. Treatment of head and neck cancer is often quite complex and tailored to the individual problem. It can involve an operation to remove the tumour, along with removal of lymph glands in the neck. It can also involve radiotherapy and chemotherapy, which can be used after surgery or in some cases instead of surgery. Also, sometimes surgery is used after radiotherapy treatment. Your surgeon will discuss any operation in detail, including the extent of the surgery, the risks of the surgery, and the issues you may develop after the surgery, in particular with your voice or swallowing. Operations for head and neck cancer are often quite lengthy and can last all day. Following the operation, you will return to a ward where the nursing staff will have the right skills to care for you. Sometimes there may be a short planned admission to ITU or high dependency for extra support. You will have drains in the neck following the operation, which take fluid away from the operation site. These will be removed when the surgeon is happy. Following some head and neck cancer surgery, you may not be able to eat and drink for a while, and you may require a feeding tube. This is inserted at the time of the operation and goes through the nose into the stomach. Once the surgical team is happy, you will start to swallow. You will have the support of specialist swallowing or speech and language therapists during this time. Your pain will be well controlled post-operatively. Even if you are unable to swallow medication, this can be given via the feeding tube. Pain medication can also be given by injection if required. Your stitches will be removed when the team are happy and usually stay in for 1 to 2 weeks, depending upon your operation and the extent of the surgery. Your treatment will be supported by a number of other professionals, including dentists, dietitians and feeding nurses, in addition to the speech and language therapists and specialist cancer nurses. If there's anything that you've heard today that concerns you, please do not hesitate to contact your clinical nurse specialist or the consultant secretary.